here. Hey ladies, welcome to our No Bad Days call with the Simple Wellness for Women group. I'm Jolene Fisher, your host, and every episode of the No Bad Days show will give you a view into the life of another woman, and she'll share her stories, her triumphs, and the things that she does in life that really catapults other people into a next level of living. And Dr. Bekki is really doing that for us. But my goal for you guys is to really become the hero of your own stories. That I want to bring topics to you that are relevant and that allow you to up-level your own life. And so you take that information and apply it. And I really want you to be inspired by the women in the calls that we are featuring each week, and help you guys to take what you're learning and to really apply it and go forth and conquer the world, right? Because all too often we live in our zone of comfort, and I'm bringing people to the show that help you get out of that comfort zone. So welcome, Dr. Bekki. I'm going to do a quick little bio of her. Dr. Rebecca Ellis is a dedicated and enthusiastic chiropractor at Clear Chiropractic in Spokane, Washington. But before she joined the team here in Spokane, she earned her bachelor's degree from Pacific Lutheran University, and she has a doctorate of chiropractic from Life Chiropractic College West. She is passionate about helping people to reach their health goals and empowering them to live their lives to the highest potential. She's an avid animal lover and enjoys spending time in the outdoors. In her spare time, you can find her walking Tinkerbell, her kitten, or tending to her carnivorous plant collection. I'm curious to hear about that. And she grew up in Anchorage, Alaska, but she enjoys the hot summers here in Spokane and the mild winters, shoveling snow and making snow sculptures. I'm also curious about that one too. So welcome, Bekki. I'm so excited to have you on the call today.
Yeah, thank you. It's good to be here.
Yeah. Would you mind just kind of giving us a background into a little bit of your childhood and what was it that brought you to chiropractic?
Yeah, I grew up and I was like, oh, what do you want to be when you grow up? I always wanted to be a doctor. I didn't know what kind of doctor, and that changed over the years. When I got braces, I was like, oh, I want to be an orthodontist. I want to do braces. This is so cool, and then I'd go to the dentist. I wanted to be a dentist. I was just amazed by the body. So I really wanted to learn more about how the body worked, and I wanted to make a difference in people's lives. As I got older, I really became more aware of my mom's migraines. My mom had migraines all during my childhood and years after that too. And I wanted to do something to help my mom not have migraines anymore. So I planned on going to medical school. I was, doing after PLU, I was doing rounds, ICU rounds. I needed a job, so I got on Craigslist and I found a job working for a chiropractor. I didn't know anything about chiropractic. I'd never been to a chiropractor. I never even knew anybody who had been to a chiropractor. So I just kind of wanted to see what it was about. And he didn't hire me for the position that I applied for, but he said, my nanny is going off to college and I need somebody to watch my kids. I'm like, okay. Like, I've never really been a nanny before. That's really not what I'm signing up for, but let's see, I'll think about it. So I decided to take the job, and I worked part-time in the office and part-time at his house taking care of his kids. And it actually ended up being a huge blessing because it allowed me to see not only the chiropractic lifestyle at the office and what that was like, but I also got to see what it was like from the home life. And I was really blown away. I grew up in what I thought was a, very natural way. And then I was like, oh my gosh, these kids don't even know what ibuprofen is. Like, they don't even ask for medications because that's just not their lifestyle. Like, they had never really had sugar. They were just so healthy and they never got sick. It was so cool to experience this whole other world. So then pretty soon after that, I got really interested in chiropractic and then decided to go to chiropractic school. Okay. So my mom then finally ended up seeing a chiropractor for her migraines, and her migraines went away. So it all came back full circle and it worked out.
Awesome. How did you get interested in the upper cervical spine? Because that is your specialty. Mm-hmm. And I'm just curious how that all evolved.
So once I started chiropractic school, you get to see all the different types of chiropractic. At least at Life Chiropractic West, we are exposed to all the different techniques. And when I first started to learn about upper cervical, I knew that it was really different. And one of the biggest things people say, oh, if you're really, really sick, you should see an upper cervical chiropractor. And I think if it's something that you should see when you're really, really sick, well, why wouldn't you see them all the time then? If it's the best, then why would you wait till you're really sick? Why not do it from the get-go?
Exactly.
So that's kind of how I got interested in it. And we see people a lot less frequently than most types of chiropractic care. And that also was really intriguing to me, that we can make a longer lasting effect in the body, that you can get better faster and stay better longer.
Right. So for me, I came to see you guys, well, I don't know, about 6 years ago now. And I had suffered from vertigo for years, about 20 years of my life, and never really knew why. Finally, I'll make a long story short, was told I needed to see a chiropractor. And I did, but I was seeing a chiropractor that just did traditional chiropractic care, and I saw some results with that. But then Dr. Rashay Bell, who is also the owner of Clear Chiropractic, she came to one of my networking meetings, and I thought, oh, that's different. I've never heard of upper cervical before. Maybe that's what I need. And I went and saw her, and
here we are.
then you came into the fold a couple years later and came on board at Clear Chiropractic. And now you've treated my husband, you've treated my son, and Dr. Bell's treated me and my other daughter. And so we all are big believers, because I have never seen relief like I've seen with my vertigo. And now I can go a whole year without even being seen by you guys. So I'm a big believer in that.
Yeah.
But what is it about the upper cervical junction that is the key that unlocks the rest of the spine? And can you educate people about that?
Yeah. It's funny because people say, what's upper cervical? It's like, well, it's not only for women. Only women have a cervix. Well, cervical means neck. So just to orient everyone, cervical is neck. So we specialize in the junction between the base of the head and the top of the neck. So that very top neck bone is where we're specialized in, which is way up at the base of your head. And the reason that this area has such a huge impact on your whole body is that everything in your body has to communicate back to your brain. So that brain-body connection is vitally important. And that very top neck bone, if you have a misalignment of that top neck bone, that can limit the amount of space for your spinal cord to drop down through that hole. If you have pressure onto your spinal cord, then your nerves are not going to function properly. By putting your top neck bone back into place, we can have the greatest neurological impact on your body. So we can take the pressure off of the nerves, and then your nerves can function properly.
Right. I think that's so interesting when you can see a visual of your neck and then see how the nerve is being less innervated, I guess, or there's not as much communication to where that nerve is feeding the communication, and each nerve of our spine communicates to something different. And so can you explain how at the upper cervical level, how that affects us from our organs to our peripheral body, and what symptoms might people be having that are actually affected by that cervical junction?
Yeah. A big one that we're seeing a lot more of recently is things like anxiety. And the reason for that is we have those two parts of our nervous system, our autonomic nervous system, all the automatic functions in our body. They're separated into two major functions. So we have our sympathetic nervous system, which is our fight or flight. And then we have our parasympathetic nervous system, which is our rest and digest. And if you have pressure onto it's called the vagus nerve, or the wandering nerve that comes through the front of your neck, that is the nerve that connects to your parasympathetic nervous system. So things like if you have a decrease in the function of that nerve, you can have things like anxiety because your body is stuck into the fight or flight. You can also have things like digestive issues because your body isn't able to function with that nerve to get into the rest and digest. So the nerves that communicate everything in the whole body could potentially be affected. We even see like diabetes. Someone a couple weeks ago, she's like, this has like my diabetes. I know when I'm out of alignment because I can check my blood sugar and my blood sugar goes up. Because for her, When she goes out of alignment, it puts pressure onto the nerves that connect to her pancreas. So she has less insulin and her blood sugar goes up. But every person's going to experience it a little bit differently because every person's body is made up a little differently, and every single misalignment is going to be a little bit different. But potentially any nerve in the body can be affected. But a big thing that I'm seeing a lot more of now is anxiety and digestive issues that people are seeking us out for, and we can make a big difference.
And how are you linking the anxiety and digestive issues with cervical spine care and nutrition? What do you tell people about that?
We don't do a ton of nutritional stuff. I teach a class in the office on Monday nights. It's called the Half Hour to Health. And we have a small section on that about nutrition. I don't do a lot of nutritional advice. Basically, I just say trying to avoid processed food is the biggest thing that you can do for your health as far as eating a healthy lifestyle. So we don't do a ton of nutritional stuff. That was one thing that really drew me to chiropractic, is it's a lot of passive care. People don't have to do a lot of homework, which it's not like physical therapy where you have to go home and do a bunch of exercises. Basically, by just doing that passive care of doing the adjustment, then we can have huge impacts. So just by taking the pressure off of the nerves, we can help the body to function better. And you can digest your food better, then you can feel better. For some people, that can mean you're able to exercise because you feel better. So that can mean weight loss. But that's not our goal. Our true goal is just to remove the interference from the nervous system to allow the body to function properly.
Oh, that's great. So you treat migraines quite a bit. Tell us how that works, because migraines can be caused by a lot of different things. So how is it that you're able to affect so much change for people with migraine?
With migraines, there's so many different factors. So, and it's hard to not get into like the the scientific of like getting that into the nitty gritty, which would go over most people's heads. But the cerebral spinal fluid is a big part of it. The cerebral spinal fluid is the fluid that bathes our brain and our spinal cord. So we have to have proper flow of that fluid, because if we don't have proper flow, then that fluid can become stagnant. And if that fluid is stagnant in the brain, that can cause your brain to not be able to get the neurotoxins, the waste out of the brain and bring new information or new nutrients back into your brain. So that can make you more susceptible to things like migraines, a lot of cognitive issues like brain fog with that as well. Another big part of migraines is the vasculature. So vascular migraines are a big thing, where if you have a spasm in one of the nerves in your brain, that can cause a migraine. That's one of the most common causes. And we can take the pressure off of the vasculature that goes up and into your brain, because the actual vasculature goes through the bones in our neck. So if we have a misalignment, that can cause pressure onto that actual artery, the carotid artery, as well as the vertebral artery. So by removing that pressure off of that, we can get proper blood flow back into the brain too. I think you're muted.
Thank you.
Yeah.
I think that one thing people are nervous about when they hear chiropractic care is the cracking of the neck and all that. So could you explain how this is different?
Yes, we don't do any bending, twisting, or popping. The adjustment we do is very, very gentle. It's very specific. It's funny, a lot of people, when they come in, sometimes they might be nervous if they don't like to have their neck popped. And then after the adjustment, they're like, that's it? That was all? It's like, yes, that's it. It's so, so gentle. We don't have to do any bending or popping because the adjustment is so specifically tailored to exactly how your bones fit together. So there's no guesswork.
Yes. Explain what it's like when you first walk into your first appointment. What do you guys do to help diagnose and then treat?
Mm-hmm. It is a very thorough process. So when you come to the office, we start with a full history. So we figure out, kind of finding out what your body has been through over the years, how things are feeling now. We do a balance and posture check. So we're looking at your body's orientation with gravity, without gravity, so laying down. We do a spinal exam. We do neurological testing, orthopedic testing, ranges of motion, thermography scans. So we do a very thorough analysis of exactly how your spine is functioning. And then we figure out what is the root cause of the problem. So where are things kind of stemming from? what's the root cause. And then once we can find that, then we can take imaging and see exactly where the problem is.
Okay. And so once you have the imaging done, then people come back maybe in a separate appointment and they get treated for the first time with the small movement treatment like you just described. And then what do they do after that? What is typical?
So after the adjustment, you get to rest. So we have a little nap area. We have zero gravity chairs. So these chairs are designed to put your body in the least stressed position possible. That way, after the adjustment, we don't send you out the front door to unwind everything we've done. This really allows your body to get used to the new position, make new neural connections so you can better hold the correction. The healing is happening when you're holding. So you want to make sure you're holding that adjustment for as long as possible.
And is it common for people to have heightened symptoms for a little bit before they get better after an adjustment?
Sometimes that can be the case. Every person's different on how they respond to the first adjustment. It might not necessarily be the symptoms that they came in with are heightened, but they'll probably notice soreness in other areas. Mid-back pain or low back pain for a day or two are common. Sometimes people will feel like a pressure in their head. They feel like there's more blood flow into their head. And I like to say it's kind of like unkinking a hose. The hose has been kinked for a long time. We unkink it, well, you feel that blood flow rushing into your head. But usually those symptoms will only last until the end of the day. And by the next day, they're feeling different in some way.
Okay. Tell us about some of your most famous cases, your favorite things, stories that you've treated. And
let's see. So one of my favorites was a person who she came to the office for migraines. She had had a continuous migraine for like 2.5 months. She was on like day 86 of a migraine. And her primary physician referred her over to our office. She came in that morning for her first appointment. She was in like really rough shape. And I felt so terrible. And I was like, I'm staying in my lunch. Like, I don't even want to take a lunch break today. I'm going to stay. We're going to take your second set of imaging. We're going to get you adjusted today because I cannot let you go one more day with this migraine. So we stayed, and immediately as soon as I did the adjustment, she was like, her eyes got really big, and she's like, what did you do? Because my migraine is gone for the first time in months. So that was a really cool thing and then she would know when she would start to get that pressure building in her head, she would know that's when she was out of alignment. So she'd come and see us every few months, and now we haven't seen her in a while. So that must mean she's doing well.
And how is it that people are able to hold their adjustment? Because I know for myself, I can hold for just about a year now, or if I fall from, like, every time I go see my mom and dad over on the west side of the state, we go skiing on the water, and I now don't do that anymore. I'm like 43 years old. I'm definitely I don't need to do that because the risk reward is not good. Every time I hit the water back in the day, my neck would just, you'd feel that feeling. And then I'd get vertigo almost immediately and suffer for a month, and finally go in and see you or the other doctors in the office. And I was like, oh, why didn't I come sooner? But why is it that I can hold for a year? What's going on physiologically in the body that's allowing that?
In the beginning of care, your body, like you probably remember years ago, this is a long time ago, 6 years ago for you, but in the beginning we see you a little bit more frequently because your body is strong in the old position and it's used to that old position. The longer you've been out of alignment, the more your body is going to be used to that. So what we want to do is get your body used to being into the new position. We can create strength in the muscles, the ligaments. We can retrain your body to hold the position. The longest I've seen someone hold was 4.5 years. We've only been open for 6 years. So 4.5 years was really good. This week, there was a couple people who've been holding for two years at a time. And some people even hold after their first adjustment. Every person's different on how long they hold, but our goal is for you to be holding for months and years at a time.
Right. And
So
that's
retraining.
I can say for my own self, but recently having traveled and sleeping on different pillows, I noticed that I get a little bit out of alignment too. So I was getting consistent headaches for about a week, and I'm like, I'm not living with this. I'm going in. So I went in and sure enough, I needed an adjustment. I wasn't experiencing
Yeah.
vertigo, but the headaches were a sign that something was misaligned. And now,
Mhm.
I mean, within that moment, they were gone, and I haven't experienced one since. So that's
Yeah.
just nice to have in our back pocket of care, is knowing there's upper cervical, because I've never known anything else to be so beneficial for my body. And that's life changing. Vertigo is like migraines. You just lay in bed all day. You can't do anything, and it's
Mhm.
debilitating. And so I really appreciate what you guys have been able to do for me and my family too. So
Yeah.
how can other people get access to upper cervical care if they don't live in Spokane, Washington, and don't
Mhm.
have Clear Chiropractic in their back door to
Yeah.
go visit?
There's a few different websites. One of my favorite websites is called ucreferral.com. So UC for upper cervical, ucreferral.com. And that website's really good because it has a map, so you can find whatever doctor is closest to you, and it will tell you if they're certified. They can only get onto that database if they're certified in their technique. So that means that those are people who know what they're doing and have been certified in their specific adjusting technique. Um, it is more limited because it's only people who are certified. So if there's nobody on that website in your area, you can also try another website, which is what that one's called? UC referral upcspine.com. So upcspine.com is another one. That one has people who they might do also other types of chiropractic, but they're at least trained in some form of upper cervical care.
Okay. And you have a very special degree that you're working toward, and the diplomat of cranial cervical junction procedures. Can you talk about that a little bit?
Yeah, so it is a postdoctorate diplomate program. So doctorate degree, after you finish that, in most types of doctors, MDs, DOs, whatever you might be, you can also continue on to become a diplomate in a certain topic. So the topic for upper cervical care is called the DCCJP, so the craniocervical junction. And it's a 3-year program. I just finished my first year, just had my first test. You take a test after a whole year of information. So it was really stressful,
Oh,
really hard test. But I just finished that this last weekend. I passed, so I continue on to the next year. And it's a 3-year program. So yeah, I'm really excited.
yeah. That's awesome.
Yep.
So when you're talking about the ucreferral.com and they would have a certification, what is the actual certification we're looking for?
Every technique has their own certification process. So Dr. Bell and I, the type of upper cervical care that we provide is the Blair technique. You can find someone on the blairchiropractic.com website that does specifically exactly the technique that we do. But every technique has a different certification process. So you have to go through a process to make sure that you are doing the technique properly, you're analyzing your imaging properly, you're doing the adjustments when they need to be, when they don't need to be. So that's Dr. Bell and I are both certified in Blair.
Okay. And is that BLAIR?
Yeah,
Okay.
BLAIR.
Okay. And I hear Clear Chiropractic is expanding. You guys
We
are
are, yes.
going to the north side?
Yeah, so we're opening a second office. The plan is sometime here in the next month or two. Of course, construction is always takes longer than we want it to, but we're going to have a sneak preview of the second office at our Dinner with the Docs event that we have coming up. So
Okay.
on January 30th from 6 to 7:30, we have a dinner at the new location. So you can find tickets on our Facebook page or through Eventbrite. And the dinner is a really fun opportunity to learn more about what we do. So it's called Let's Get Clear on Getting Your Head On Straight, because we like to say we want to get your head on straight. And so we'll be opening the new office shortly after the dinner, probably in the next month.
Okay, great.
Yeah.
Is there anything else that you want to cover that you feel is important for people to know that we haven't gone over yet?
I think it's important to make sure you seek care. And if you've been to another chiropractor and it wasn't for you, I like to say, if you went to a dentist and you didn't like that particular dentist, I hope that you wouldn't just throw your dental care out the window. Find someone else. There's so many different techniques within chiropractic. So definitely check out upper cervical. And it's important to take care of our bodies, health as well. If you don't have health, then you can't have anything else. Like you're talking about, if you have vertigo or migraines or abdominal neuralgia or MS, there's so many different things, and there are natural alternatives out there. So just seeking the care that you need. Just like with you, if you went going water skiing, like what would you do if you didn't have like care to go seek? Like I think that all the time people come back like, I just got back from vacation and my neck is killing me. I'm like, what would you do if you didn't have us? Like I'm so happy that you know about us and we can get you back in alignment, and now you can live the life that you want to.
Oh, so absolutely. Definitely.
Seeking that care when you need it is so important.
Yes. And use your insurance, use your HSAs if you need to. It doesn't have to be as expensive as you think it is, and it really isn't that expensive to go see Clear Chiropractic, because our whole family's seen them and been able to afford it. And what is your health worth to you? Because it's so amazing what you might be able to overcome as a result of this. And like you were saying, I think it's important too, because I'm a nutrition guru, and I think that in order to absorb the nutrition that we need to absorb, our guts need to be healthy, the microbiome needs to be healthy, but that does come from that vagus nerve, and that vagus nerve transmits all those signals back and forth from the brain to the gut. And so in order to be the healthiest we could possibly be, we need to not only incorporate this type of care with the nutrition care that we're already doing. You can't do one or the other and expect amazing results. You have to kind of combine the two, and really you will get the best results you possibly can for your health. And so, yeah, that's great. I love it. All these connections. I was just learning about the vagus nerve. Well, not just, but I've known about the vagus nerve since my college years, learning in athletic training about it being one of the 12 cranial nerves, and really didn't know much about its connection to gut health and brain health and anxiety disorders and all that. So I'm excited to hear that that's what you're treating a lot of, because we certainly have quite a bit of issues surrounding that these days.
Yes. Yeah.
What are some of the case studies you found this has been really helpful for with the mental side of things?
There's just a lot of people with anxiety out there, and a lot of people just don't realize that their anxiety could be caused from something physical. It's like a lot of people think that it's in my head, and it's not in your head, it's in your neck. It can be in your neck. So a lot of people, when they first start to notice it, even if they don't have really intense anxiety, maybe just a small amount, a small healthy dose of anxiety, but they'll say things like, I used to get a lot of road rage, and I really don't get that anymore. Things don't bother me as much as they used to. Or I had someone who he would always know when he was out of alignment, because he would say, I've been really grumpy lately, and I know that that's because I'm out of alignment. I had a friend in
chiropractic, and sure enough, yep, there it is.
Yeah, exactly. I had a friend in chiropractic school who, one of the big reasons that she ended up doing the Blair work is that her sister had really, really bad depression and anxiety. And it was so bad, she was at the point of, she had attempted to take her own life multiple times. And so she got under upper cervical care, and it cleared up. She was just lifted out of that depression. Right. And that was what motivated then my friend to then go to chiropractic school and become a Blair chiropractor, because she saw the amazing transformation in her own sister, and she's able to get her life back.
Wow.
Yeah.
So crazy good. Crazy good.
Yeah, exactly.
What about for athletes, especially football players or people who have these big helmets on their heads and getting hit all the time? What's going on there?
Yeah, so much. One of my mentors and one of our teachers in the diplomate program actually works with a lot of ex-pro football players. So he actually did a documentary with Jim McMahon, and Jim McMahon, he did a 30 for 30, which is something on ESPN, 30 minutes on certain topics. This is the only one I've ever seen because, of course, this is what's relevant to me. But he talks a lot about how there's so many ex-football players they've had so much brain trauma, and CTE is becoming a huge thing, and post-concussion. And there was that guy recently with the Seahawks, and he's talking about how he wasn't in football shape or whatever. And he talks about how being a football player is kind of like getting in small car accidents. Every single time you get hit, it's like a small car accident. And it is. Imagine if you were in multiple car accidents day after day, your brain just gets traumatized.
Right.
So they did this 30 for 30 with Jim McMahon, and he explains his experience of having his first upper cervical correction as if there was a toilet bowl flushing out of his brain, because he just felt so much pressure inside of his head from all that cerebral spinal fluid being stuck in there, and everything just releases. So we work with a lot of athletes to help to prevent CTE, to prevent pressure into their brain, and to keep their body functioning at the best level that they can.
Right. Well, my son's a football player at WSU. I think a lot of people who are listening know that, but he recently came and saw you guys and felt a lot of pressure release as well, and fog lift. Just kind of the fog lifting and being more clear-headed was a big symptom of getting the chiropractic care that he needed. So that's really exciting. What's the name of the 30 for 30 on ESPN, that episode? Do you know the name of it?
I don't know the name of it, but it's Jim McMahon is the player. So we can look that up.
Okay. Yeah. Thank you.
Dr. Scott Rosa is the chiropractor who works with him.
Okay. I guess another thing that just came to my mind too is you treat all ages, right? Babies all the way up to elderly. Right?
Yep. All walks of life.
Okay. Great.
Yep.
Good.
Yeah, we love seeing babies. The most common first misalignment in the upper neck is from the birthing process itself. So we like to see babies within about the first 30 days is really ideal.
Okay.
So we see lots and lots of babies.
That's great. Because if they're misaligned as a baby, the way they show symptoms would be maybe colic, right?
Colic's a big one. Yeah. Okay. Sleep issues, throwing up. A lot of babies, spit up is normal, but if they're regurgitating everything that they're putting down, that's definitely not normal. Arching of the back is a sign, crying in their car seat, and just if they look uncomfortable, that's a sign of being misaligned.
Okay. And what about children? Like, what are some of the ways they manifest the pain or the suffering coming from that upper cervical, since they're a little bit different than adults and how they would explain it? What would you see in children?
Kids, every kid is a little bit different. Behavioral issues can be a sign of misalignment too. I'm working with a couple little ones right now who are either on like that anxiety and that anxiety kind of world, or even on the spectrum, and they'll notice a huge difference of being out of alignment versus in alignment, and the parents can tell almost immediately after they've been under care for a while, because there's such a huge change in their behavior. But pain is not normal for kids to have. Kids shouldn't have any pain at all, really. So if kids are having any kind of an ache or a pain that's lasting, more than a day or two, if you fall and fall off your bike and your arm hurts for a day or two, that's normal. But if headaches, digestive issues, those kinds of things are definitely something that you want to look into.
Okay, great. I think that it's important to note that without the brain and the nerves, we would have nothing. And so that clearing up the communication between the brain and the rest of the body is really the key that unlocks the rest of the health of the body. Yeah. And so really it treats everything. So yeah. What about even, I know the heart and its functioning and the speed of the heart, or arrhythmias and things like that. Mm-hmm. How have you seen this affect the heart tissue as well, if people have had issues along that line?
Yeah. A big thing, one of the topics we went over quite a bit in the Diplomate program is POTS, which is postural orthostatic tachycardia syndrome, which is a syndrome where when you go from sitting to standing, if you get very lightheaded, it's almost like a feeling like you're going to faint. And a lot of people will feel that postural change and they feel their blood pressure dip. But the thing that's different with POTS is that the heart rate also really increases. And this is a neurological dysfunction. If the nerves between your brain and your heart are not functioning properly, then when you go to standing, your blood pressure should raise a little bit. So that way you can keep the pressure of the blood up into your brain. But if for some reason your brain and your heart are not communicating properly, then that doesn't happen. And that's why you get that sensation of feeling lightheaded. So one of the things that we can do is restore that connection of your brain and your body. We can restore that connection back to your heart from your nervous system, and that sensation can be helped too.
Okay, great. We do have a question.
Yeah.
You talk about helping with digestion. Have you ever seen it help with teenage acne?
I'm trying to think. I feel like a lot of patients, they might have changes that they just don't tell us. But I don't know if I've seen it directly. I would say a big thing with acne is usually food intolerances, if you're eating things that are really not good for your body. So that would definitely be, I would say, a Jolene question. I would refer out to that for that, because acne usually skin issues can be related to food. And with teenagers, oftentimes that can also be hormones. So your hormones can be affected with the upper cervical spine. So it would be a good place to start. But I would say definitely that would be one of those things where you want to have multiple healthcare practitioners on your team to help with that, because a big part of acne typically is food.
Yeah, definitely. The increase in the sebaceous gland activity can be caused by dairy specifically or food intolerances, but gut health itself, if we have leaky gut syndrome, where those whole food particles are leaching out into the bloodstream, causing inflammation. If inflammation is ultimately what causes some of that acne too, then we need to bring down that inflammation in the body. So definitely linked back to food, but specifically cleaning up the gut lining and making sure it's nice and tight, those junctures, I think.
Yeah.
But then maybe the person finds they can start eating dairy again, but that has to be fixed first. And like you said, it kind of comes from the top down. So if the cervical spine isn't healthy, then it's not communicating well to the gut. The gut can't communicate well back to the brain. So we're getting this miscommunication going on, and healing can't take place to the full extent that it could possibly take place. So it is just a matter of really doing everything.
Yeah. We wish there was a simple solution, but oftentimes the body doesn't work that way.
Yeah. I just want people to be able to connect the dots here, because we have learned so much misinformation over the years about how to make a body healthy, right? And now we're finding, since 2007 really, and into the future, about gut microbiome, and they've studied the human genome, the human gut microbiome. You have all this knowledge that you've learned about the cervical spine, and it's just kind of new information for a lot of people that are watching today. They've never really heard of that before, or that there was a technique that would correct that. I just think we're on the cusp of learning so much stuff that is really going to be the forefront of the future of medicine, and how we treat ourselves and how we become our own patient advocates and learning. And so learning is so important. And thank you for being here today to teach us a little bit about this technique that not a lot of people knew about. And hopefully they see care in that way. So I think it's important. Yeah.
Yeah.
And Dr. Bekki is in the No Bad Days Simple Wellness for Women group. So feel free to connect with her in there. And if you want to create an appointment with her at Clear Chiropractic, she is on the South Hill, and they are opening up another office on the north side here shortly in the next month. But also just a reminder, January 30th from 6 to 7:30, they're having their dinner with the docs, and they're going to be talking about getting your head on straight. So more information about that would be found at their office or connecting with her directly. So I want to just end it with that. And thank you so much for being here again and imparting all your wisdom onto all of us. And thank you. Bye, everybody. Bye, Bekki.
Thanks,